Right, how you doing? Our condition of the month, I thought I'd do sciatica. It's a very, very commonly used terminology. Basically means any pain down the back of the leg, and is often misinterpreted as any pain down the back of the leg. But sciatica itself is effectively a pain tracking down the main nerve that runs from the base of the back all the way down the leg. It can be very much intermittent, it can be very much constant there all the time. I mean, we've had people in the past that just get it with certain movements, certain positions that they sit or move in. We get other people and they are in constant pain. They crawl in. If it's left for a long period of time or if it's treated inadequately, we've had people in the past coming in where they're actually getting foot drops, so the actual foot itself, instead of walking properly like this, literally just flops down to the floor. And there's not much that can be done once you get to that stage. Occasionally surgery can help, but if you catch something beforehand, you can make a massive, massive difference. So what are the causes of sciatica? It can be a myriad of different problems. It can literally be, quite simply and most commonly, the actual vertebrae, the bones in the base of the back, instead of being nice and level, as they should be, like this, one of them is twisted. So as the nerve comes down, it's been irritated. It could be a muscle. There's a very common symptom called piriformis syndrome, which is where the little muscle, which is, it runs into your buttock, becomes very, very tight. And some of the symptoms you tend to find with piriformis syndrome, it might be you have the leg pain, but when you're actually using it, it starts to relax the muscle and the symptoms go away. Now, in an older generation, it can be caused by degeneration, so severe wear and tear. And we do sadly see an awful lot of people that have had recurrent on and off back problems over the years that they've just ignored. So with a lot of these things, if you can catch them when you're younger, so you get that first symptom and you can start making that improvement, in particular within the first sort of like 4 to 6 weeks, the likelihood of preventing a long-term problem is going to be that much better and that much easier. I think the thing is, you also need to look at some of the more severe causes of sciatica, which could well be some sort of nutritional neuropathies can affect it. You can get, worst case scenarios, cancers or other lesions pressing on it. Obviously, that's one of the reasons that when we get a lot of our clients in, we are doing full consultations. We are doing everything we can to rule out anything that it could possibly be. I'd like to think that over the last 12 years that I personally have been working, we've only found a couple of pathologies. Both of those have been dealt with very, very rapidly, and one of those clients is still actually seeing myself, and she's responded brilliantly over the years. So what can you do to prevent sciatica from becoming a problem? Firstly, get yourself booked in for a consultation so we can find out exactly what's going on. Obviously, if it's a subluxation where that vertebrae is out of position, that's something that we're going to definitely be able to help with, and we should be able to make it a good improvement. If it's something that has been there for a long period of time, we may not necessarily make a massive improvement, but we can certainly look at trying to help prevent that from getting any worse. And I think that should be key. If you have had something for a long period of time, you don't want to just leave it to get worse. It's a little bit like having a rusty gate in the garden. You don't leave it so it seizes up. You put some oil on it, you get it moving, and then you move on from there. Exercise, there's an old law in physiology called Wolff's Law, which means use it or lose it. If you're not moving and you're not exercising, you are going to seize up. So, regular exercise makes a massive difference for things like this. And as long as you're keeping those joints mobile and you're keeping everything freed up, you're going to be able to make an improvement with this. So when you're picking the actual clinic that's right for you, make sure that there's someone that recommends exercises. If they're just getting you in and adjusting you and that's it, they're not giving you the fullest care that they possibly can. They want to be guiding you and helping you, not just sort of with the adjustments, but with exercises and nutrition and so on and so forth, to get you the best care that that you really deserve, and that you actually need to take you where you need to go to. Again, another little simple trick that we've discovered over the years that's very helpful is, gentlemen, if you keep your wallet in your back pocket, every time you sit down, that wallet is pushing your pelvis up slightly. And that imbalance will, over a period of time, irritate those nerves and can create those sciatica, those leg symptoms. So again, try and move your wallet from your back pocket to your front pocket if you want to keep it in your trousers, or ideally keep it in your jacket pocket or your shirt pocket up here. Other than that, the only thing I would say, word of warning, try and steer clear of taking any anti-inflammatories and that sort of thing, painkillers, because all they're doing is just masking up those symptoms. And in particular with the non-steroidal anti-inflammatories, long term, they can actually be quite dangerous and have a real sort of effect, harming effect on your body. If you look at some of our other videos, you will find that I have actually done a video on non-steroidal anti-inflammatories. It's well worth reading that and really getting up to speed with the recent or the latest data. Other than that, I look forward to speaking to you next month, and we'll go over something else that's recently come into the clinic and I can talk you through it. So thank you very much. I'll speak to you soon.